let's discuss about a study which demonstrates how beta blocker use after thoracic endovascular aortic repair in patients with type B aortic dissection is associated with improved early aortic remodeling. Beta blockers are first-line anti-impulse therapy in patients presenting with acute type B aortic dissection. However, very little is understood about their impact after aortic repair. The main objective of the study was to evaluate the role of postoperative beta blocker use on outcomes of thoracic endovascular aortic repair in type B aortic dissection. Coming to the methods of the study, the Vascular Quality Initiative database was assessed for all patients undergoing thoracic endovascular aortic repair for type B aortic dissection from 2012 to 2020. Aortic-related reintervention, all-cause mortality, and effect of thoracic endovascular aortic repair on false lumen thrombosis of the treated aortic segment were evaluated and compared between patients treated with and without beta blocker postoperatively. Coming to the results of the study, a total of 1,114 patients undergoing thoracic endovascular aortic repair for type B aortic dissection were identified with the mean follow-up of 18 plus or minus 12 months. The mean age of the patients was found to be 61.1 plus or minus 11.9 years, and 71% patients were found to be male. A total of 84% patients were maintained on beta blocker at discharge and follow-up. Patients on beta blocker were more likely to have an entry tear originating in zones 1 to 2. The prevalence of acute, elective, and symptomatic AD, concurrent aneurysm, number of endografts used, distribution of the proximal and distal zones of dissection, and operative time were comparable between the two cohorts. At 18 months, significantly more complete false lumen thrombosis was observed in patients on beta blocker, while the rates of aortic-related reinterventions and mortality were similar in patients prescribed with and without beta blocker, respectively. Even after adjusting for clinical and anatomic factors, postoperative beta blocker use was associated with increased complete false lumen thrombosis, but did not affect mortality or aortic-related reintervention. A secondary analysis of beta blocker use in acute versus chronic type B aortic dissection showed a higher rate of complete false lumen thrombosis in patients on beta blocker in chronic type B aortic dissection. In contrast, there was no difference in the rate of complete false lumen thrombosis in acute type B aortic dissection between the two cohorts. When analyzed separately, postoperative ACE inhibitor use did not affect the rates of complete false lumen thrombosis, mortality, and aortic-related reintervention. To conclude, beta blocker use was associated with promotion of complete false lumen in patients undergoing thoracic endovascular aortic repair for type B aortic dissection. In addition to its role in acute setting, anti-impulse control with beta blocker appears to confer favorable aortic remodeling and may improve outcomes after thoracic endovascular aortic repair, particularly for chronic type B aortic dissection.